this table titled Assessment of Fetal Situs/Laterality and the Four-Chamber View is part of the updated ICE Work Practice Guidelines published in 2013 titled Sonographic Screening Examination of the Fetal Heart. I will use this line diagram to explain some aspects of this table. Situs and general aspects. First, fetal laterality. Identify right and left sides of the fetus. There are many ways of identifying the right and left sides of the fetus, but probably the one that stands out is for the sonologist to assume the position of the fetus and label his right as the right side of the fetus and his left as the left side of the fetus. And then determine that the stomach and the heart are on the left. This should be done after identifying the right and left sides of the fetus and not the other way around. The heart occupies a third of the thoracic area. We shall see that in real time. Majority of the heart is in the left chest. Note these levels. This is the spine. It is the descending aorta. So if we draw a line from the spine to the sternum, you realize that most of the heart is in the left chest. The cardiac axis, apex, points to the left. This is the cardiac apex. It points to the left by 45 plus or minus 20 degrees. If we draw a second line that crosses the interatrial and interventricular septum like this axis between these two lines should be 45 degrees plus or minus 20 degrees. Four chambers present. 1, 2, 3, 4 chambers present. Regular cardiac rhythm, we shall see that in real time. No pericardial effusion, we shall see that in real time. Atrial chambers, 2 atria, approximately equal in size. 2 atria, approximately equal in size. Foramen ovale flap in left atrium. Foramen ovale flap in left atrium. This is better seen in real time. Atrial septum premium present near the crux. Atrial septum present near the crux. We shall see the definition of the crux in the next slide. Pulmonary veins entering left atrium. Here you can see pulmonary veins entering the left atrium. So this is the morphological left atrium because 1, this is the chamber closest to the spine. Number 2, the foramen ovale flap beats towards the left atrium. Number 3, the pulmonary veins drain into the left atrium, while the right atrium receives the IVC and the SVC. Ventricular chambers. 2 ventricles approximately equal in size. 2 ventricles approximately equal in size. No ventricular wall hypertrophy. We shall see that in real time. Moderator band at right ventricular apex. This is the right ventricle. This is the apex. This muscular band is called moderator band. It's a feature of the right ventricle. Ventricular septum intact from apex to crux. Ventricular septum should be intact from apex to the crux. Atrioventricular junction and valves. Intact cardiac crux. Intact cardiac crux. Again, we shall see the definition of the cardiac crux. Two atrioventricular valves open and move freely. We shall see that in real time. Differential offsetting. Tricuspid valve leaflet inserts on ventricular septum closer to cardiac apex than does the mitral valve. Tricuspid valve inserts closer to the apex than the mitral valve. This is what is called offsetting. So, what is the crux of the heart? The crux in the center is formed by 1. The interventricular septum. 2. The septum premium. 3. Valve of mitral. 4. Valve of tricuspid. 5. Atrioventricular septum between the left ventricle and the right atrium. Between the left ventricle and the right atrium. So this area in yellow is the crux of the heart. These are two different images of the heart. This is the lateral view, while this is the basal view. The third view is the apical view. We have seen the situs and general aspects in respect of fetal laterality, location of the stomach. The fact that the heart occupies a third of the thoracic cavity, as you can see here, the spine, descending aorta, lungs, the heart. So the heart here occupies a third of the thoracic area. The heart occupies a third of the thoracic area. Majority of heart in left chest. If you draw a line from the spine to the sternum here, majority of the heart will be on the left side. Cardiac axis points to the left. Cardiac axis points to the left. Cardiac axis points to the left by 45 degrees plus or minus 20 degrees. 4 chambers present. 1, 2, 3, 4. 1, 2, 3, 4 chambers present. Regular cardiac rhythm, yes, by eyeballing, regular cardiac rhythm. No pericardial effusion, yes, as you can see, there is no pericardial effusion. Here you can see slight fluid coagulation here, and here, this is normal. Pericardial effusion is when the fluid coagulation is more than 2 millimeters, and it is measured at the atrioventricular junction. Atrial chambers, 2 atria, approximately equal in size. 2 atria, approximately equal in size. Foramen ovale flap in left atrium. Here you can see this is the spine. The chamber closest to the spine is the left atrium. Then you can see the foramen ovale flap between towards the left atrium. Atrial septum premium present near the crux. Atrial premium present near the crux. Atrial septum premium present near the crux. Pulmonary veins enter the left atrium. Here you can see one pulmonary vein and the other one here entering. So 2 inferior pulmonary veins are seen here entering the left atrium. Ventricular chambers, 2 ventricles approximately equal in size. 2 ventricles approximately equal in size. No ventricular wall hypertrophy. No ventricular wall hypertrophy. No ventricular wall hypertrophy. Moderator band at right ventricular apex. Moderator band is seen at the right ventricular apex. Here again you can see part of the moderator band here, and septal chordae tendineae, which is also a feature of the right ventricle. Ventricular septum intact from apex to cross. Ventricular septum intact from apex to cross. Ventricular septum intact from apex to cross. The best position to assess the ventricular septum is the lateral view. In the apical view, dropout artifacts may be mistaken for inlet ventricular septal defect. Atrioventricular junction and valves, intact cardiac crux. Intact cardiac crux. Intact cardiac crux. This has ruled out atrioventricular septal defect. 2 atrioventricular valves open and move freely. 2 atrioventricular valves open and move freely. 2 atrioventricular valves open and move freely. Differential offsetting. Tricuspid valve leaflet inserts on ventricular septum closer to the cardiac apex than does the mitral valve. Tricuspid valve open closer to the apex here than the mitral valve, as can be seen clearly here. The same thing can be seen here. Even embryologically, you can see the tricuspid valve leaflet is closer to the apex than the mitral valve. This is called offsetting. Color examination of the heart improves the detection rate for cardiac malformation, but the settings and the plan must be optimal. These still images show the retrocardiac area. The only structure that should occupy the retrocardiac area is the descending aorta. Occasionally, a cystic area may be seen between the posterior aspect of the heart and the descending aorta, and this is the esophagus, which fills and empties in real time. Is the spine, descending aorta, lungs, the heart. The heart in lateral view, here the heart in apical view. The area behind the heart should not measure more than 2 millimeters. Remember, the retroplacental area is also around 2 millimeters. Pericardial effusion is defined when the fluid is more than 2 millimeters. Here you can see the descending aorta has taken up color, while the esophagus has not. Now, this is a video demonstrating the retrocardiac area. So here you can see the descending aorta, and the esophagus fills and empties. You see that? Fills and empties. So this is normal. When you see any vascular structure here, then consider anomalous pulmonary venous collection, total, partial, or isolated. Here you can see the fetus defining the anatomy for us. Four-chamber view, back to the upper abdomen, then 5-chamber view. Here you can see 1, 2, 3, 4, 5 chamber view. Anomalies that can be seen in the 4-chamber view are diaphragmatic hernia, pericardial effusion, cardiomegaly, atrioventricular septal defect, hypoplastic left heart syndrome, hypoplastic right heart syndrome, FCN anomaly, tetralogy of Fallot, and many other conditions. Thank you very much.